And she doesn't get tired? She can do this for quite some time?
Yes, it's not normal. It's not normal.
No,
Her energy is not normal.
What do you mean with that?
She can
It's not normal now, or it's not normal in general?
She can weeks sleep 3 hours a day. I'm exhausted and
Yeah.
she's full of energy.
Yeah, so she's definitely energetic,
But they
excessive.
Excessive, but they are periods. She's also exhausted, and then she is a few times or a little weeks she's calm.
It's always something that is filed away. It's too painful for the patient to really think about it. So what do you do with painful things in your life? You put them right into the unconscious, where you hope it stays there and won't bother you too much. The second issue, the 10 intra-uterine questions, is something that allopathy really knows nothing about it, and homeopaths neither. Therefore, it is a good thing for me to teach this to you. As we are confronted worldwide, I must say, it's not just in the United States, you know you're confronted with what I would call a lot of challenged children. Challenged children who get, of course, many names like ASD, Autism syndrome. Parents are not pleased to get this name, although doctors think they do a tremendous favor to the parents by classifying them in a name. And then, of course, the next 2 questions come. You know, why is my child this way? And number 2, can you do something about it? And of course, allopathy always has to say no on both of it. So we homeopaths really can answer both those questions in a positive way. When, of course, we really investigate something that most of us don't really do yet, which is what I would call the emotional trauma intrauterine. You must understand it has a tremendous influence on the fetus, on the unborn fetus, and therefore is the creation of many challenged children.
You have to watch all that, and then you think, why is that happening? No, why is this? That's not normal. The child wants to be with the mom, normally like this one. That's normal, although excessive. But when it goes to the father and wants to lay on the bare skin of the father with his bare skin, it tells you something, no? But of course, when you listen to the history then, the mother didn't want that child. And you know, that's what I call la mystique, la participation mystique, no? The mystical participation. If you think that message didn't go through, think again. It went clear and loud through. The child knows. So then I know this intrauterine life is not preparation of life, it's life. It's really loud and clear life. I used to laugh and mothers put their little music box on the belly and everything like that. I don't laugh at that anymore. I encourage them to do so.
So this is your task anytime, is to find in any patient, yourself included, what is this core delusion? Because the simillimum lies in the core delusion. The dangers, of course, with the persona, it's still depending what happened to you. You see here, this is part of the conscious of the person that comes to you. And of course, what he wants to present to you as a patient, talk about the persona now, what he is conscious about, because this is the consciousness, is obviously his chief complaint. That's the first thing that he concentrates on. And of course, what he actually can do, if you're smart enough, you can't really stop that. At least, we hope that most homeopaths will be able to go them, but how did you deal with this? They become part of the personal conscious, and usually it is the information, without any doubt, that one gets the easiest out of the patient, right? This is really what you get easily for it. Unfortunately, it's the thing that gives you the least instruction or the least information to really get to the simillimum, unfortunately. The delusions, the homeopathic definition of a delusion, are for us nothing but fixed ideas, by the way, which are always caused by a long-term, old emotional trauma most of the time. It can be a physical trauma too, but most of the time it is related to a painful, unresolved emotion from the past. But Alumina, as you see, is basically has the core delusion. The consciousness belongs to another. As you understand what it really means, remember thought control. This is the thought control core delusion rubric right there. The consciousness belongs to another, because what happens is basically we have these rubrics that
When he sees something, it is as he sees the illusion come. When he sees something, it is as he sees through someone else's eyes. It's not an easy task because the mothers will be very resistant. You have to be very careful with it. You know, I understand it very well. You know, they really have guilt feelings. What did I do wrong? And now you open the can, the pot of Pandora here, the box of Pandora, and you really want to know what's in there. You know, Jung would have called it, it's all created by a high feeling tone complex, he called it. No, the very sensitive issue that you have, and I don't want to talk about it. Yet, it's of course the solution for that child. That's the unfortunate thing. I personally must say I have never had too much of a problem when I talk to them. You have to be careful how you approach it, and I never had any mother refusing to me of not giving it to me, to tell you the truth. But this is what your task is, because that's where the solution is. No? The core delusion gives you the simillimum. The rest is a simile. That's in for the shadow versus the mask. Big difference, okay?
You know, I had cases, 1 drop, not enough. 3 drops, too much. 2 drops, perfect.
You know, autism is not about really longevity. They live a long life. And I just think about what's going to happen with all these children. But it's about quality of life, no? This is really the thing that you have to restore. So when you talk about success rate, I need to talk about quality. What can we achieve? And here again too, what can we achieve, right? You know, again, we have this whole array from 0 to 100, from very severe handicap to really not so bad, you know. But again, this is for you to do step by step. Because I love to answer questions, I must say, because everything you're going to ask me, I have seen in the practice that if anything I want you to do, make sure you don't make the mistakes I made, you know, that don't want you to do that, don't want you to lose your time. I know for sure what obstacles you're going to have from other doctors, from other therapies, from other family members, name it. And I want you to give courage too. I always say to you, every patient coming to you has a wonderful story, okay? We all have a wonderful story, even Greek trauma, Greek tragedies, okay? But you know, we all have a story, a beginning, where are we in the story? It's wonderful to find out. It's love for people you have to have, and I'm sure you do, that you want to find out, where is he in the story? How can I help him to get on the road again, to really where he was destined to be, you know, and by the way.